Nick Ferrari at breakfast on LBC. Call 0345 6060 973.
10 minutes for it. Just a couple of emails from the top of the pile concerning this pay rise, the conversation we're having about NHS staff even. Sid says, what a day. For once, I'm in complete agreement with you. This time on the NHS pay offer. I'm not even going to bother to put my feelings into words. I've just heard them all come out of your mouth, Nick. Mike in Crawley. Did I clap for the NHS every Thursday? No. Not because I did, or indeed did not appreciate them, but because I thought it was a cheap political stunt and suspected that when it came to pay conditions and free car parking, NHS staff would, if I could borrow a famous phrase, be at the back of the queue. All right, we'll continue that conversation in a moment. Now, as we emerge from the pandemic, we know that a lot of people, particularly younger people, are going to need help. Help not just with the schools, which of course reopen on Monday for all children in England, but emotional help as well. And as part of that, a new government initiative so that children and youngsters can access expanded mental health services with backed by some money. Here to explain more is Mental Health, Suicide Prevention and Patient Safety Minister and Conservative MP, obviously Nadine Dorries. Minister, how much money are we talking about here and how will it be spent? Good morning.
Good morning, Nick. I don't have the total spend, Nick, but what I will say is this. I'd just like to begin by saying that obviously as a former nurse myself, we completely value and appreciate our nurses and doctors and the NHS and all that they've been through over the past year.
OK, well, I wasn't going to get to that first. Minister, I find it extraordinary that you've been put out to talk about a new initiative and you have no idea how much it's costing. But given the way that this government is handling the National Health Service as it comes to funds, I suppose this is to be seen. Have you had your vaccine yet, Minister? Because if not, will you be able to... You have you? Yes. Would you be able to look the nurse in the eye and think you're doing him or her fair by this pay rise of 1%, Minister?
So, Nick, I think it's important to explain that over the past year, newly qualified nurses have received, quite rightly, a 12% increase in pay over the past 3 years and are now on an average salary, again, quite rightly, of $34,000. And that many people, nobody else, no other employee in the public sector will be receiving any pay rise whatsoever. And many people in the private sector have lost their jobs.
This is not a race to the bottom, Minister, is it? This is not a race to the bottom, is it?
It is not, but it is as a race to save our economy. And our priority has been about saving livelihoods, continuing the furlough scheme, saving businesses, because we don't have a strong economy. If we don't have people employed, if we don't have strong businesses, we don't have the revenue or the funding to continue funding our NHS.
Right, you want to talk about revenue, Minister. OK, you want to talk about revenue and spending. The test and trace, how much did that cost, roughly?
Again, Nick, I think it may be 20 billion, but I don't know the exact figure.
It's £37 billion. So your government can find £37 billion for a test and trace system that I think many accept could have done better, but you can't find anything more than 1% for nurses and other NHS staff. Perhaps you'd like to explain why.
So a year ago this week, exactly a year ago this week, we were looking in the face of a global pandemic. And our priorities were about saving lives and protecting the NHS. And that money that you've just spoken about, which is spent on test and trace, was about doing just that. That was a priority of saving lives. Now that we are hopefully coming out of the pandemic, our priority has to be about saving people's jobs and people's livelihoods. And that is where our prioritisation in terms of funding has to be. We have to continue the furlough scheme. We have to continue providing grants to businesses so that they can continue to keep running. And we've made an offer to the pay review board of 1%, which is what we can afford in order to continue furlough. And we've made that offer in the face of the fact of our understanding that many people in the private sector have lost their jobs or taken huge reductions, and no one else in the public sector will be receiving a pay increase. And as you spoke about nurses at the beginning of this programme, they have received a 12% increase over the past 3 years, which takes them to a salary of £34,000. We hope, obviously... Sorry.
You'll be familiar with the pay rise that politicians are to be awarded, of course.
We're not getting anything.
You had a 10% pay rise recommended some months ago.
And we refused it.
Well, I think some people have taken it, haven't they?
No, it's been refused.
All have refused that. Okay. Let's come back then to other initiatives, as well as test and trace. Yesterday, the Prime Minister announced £100 million for a scheme to try and get the country fitter that will provide for shopping vouchers if we hit the necessary amount of steps. Again, £100 million can be found for that. Why?
So out of the 2.5 million people, I believe it's 2.5 million people who have died worldwide, 2.2 million of those people, billion of those people were 2.2 million of those people were overweight or obese. And I think if there's one thing that we've learned over the past year, it's that the link between coronavirus, death and obesity is undeniable. And it is 2.2 million, actually, out of 2.5 million people who've died were obese. And therefore, I think we believe that tackling public health, England believe that tackling the obesity crisis, which we are now facing, and it's undeniable we are facing an obesity crisis, some startling figures of children under the age of 10 who are now clinically obese. We have to do something to tackle this. If we want people to continue living long lives in good health, right, then we have to do something about tackling obesity.
But why can 100 million be found for that and only 1%
because that's
found?
about saving.
But surely NHS staff are about saving lives as well, aren't they?
That's about saving lives, and it's also about protecting the NHS and saving the NHS. But Nick, I don't want you to we'll leave this interview with you thinking that we don't appreciate. I'm a former nurse myself. I was a recipient back in the day of a nurse's pay increase. I know what it's like to work on a nurse's salary. I know what it's like to work the hours that we did and the hours that nurses do now to work those 12-hour shifts. I never worked a 12-hour shift in PPE. I can't imagine what that is like. We are hugely, hugely grateful. But we spent 10 years, this government, fixing the economy, getting it into a stable place after the mess we inherited from Labour. Right. Our priority now has to be to continue to keep that economy stable, because only with a stable economy can we make pay awards in the future. The pay awards that we've just made over the last 3 years of 12% to nurses, of course we would want to do that in the future, but we can't do it without a stable economy.
Minister, it's not how you leave me, I assure you. It's how you leave my listeners who have responded, and I'm holding up emails, whether you can see them now. They talk about this as being insulting. They talk about this being absurd. They talk about this MPs having apparently claiming, it says here, for earpieces and computers and laptops so they can work from home. I don't know whether that's true or not. They talk about this being disgraceful, and they talk about it, well, in even language here that I can't even say. They talk about it being wholly wrong, let's put it like that. So it's not me, it's those, and those are the people that you're losing. But just coming back finally to the reason that I'm enjoying our time together. Go ahead.
Every employee who works from home for any company is given, you can't work from home unless you have a laptop or a computer. And so some of the criticism I'm very happy to put my hands up and accept. But criticising MPs because they're working from home and being provided with a computer to do so, I'm afraid it's not a fair criticism.
All right, OK. And there's suggestions now that nurses might leave the profession to go and work at a supermarket where they'll earn more money. I know you quoted £34,000, but you know what a newly qualified Band 5 nurse, newly qualified, what he or she makes, don't you?
So we have record numbers of nurses, record numbers of people applying to join the NHS right now, record number of people wanting. And I think the one thing that coronavirus has done over the past year is it's shown people what a rewarding career working in the NHS can be.
Rewarded with a 1% pay rise, Minister. Did you choose the right word?
When I was a nurse, we did not receive, I told you, I was in receipt of a pay increase when I was a nurse, but it wasn't 12% over 3 years. And I didn't earn anything like the equivalent salary of £34,000 as nurses do now.
Well, I just wonder how
they deserve it.
All right, I just wonder how the nurses and doctors who saved the Prime Minister's life will react to getting a 1% pay rise. Those who work 24 hours a day to save Boris Johnson, wonder how they might react. OK, finally...
comment.
Pardon me?
Because as you know, I think that's an unfair comment, Nick, because as you know, those nurses saved the Prime Minister's life, like they've saved many lives, thousands of lives over the past year. Nobody who has been in that position of needing their life to be saved, and needing the assistance of others to breathe.
All right, Minister, can I
suggest that they would come out and not appreciate and hugely value that, I think, is just wrong. We all absolutely value.
Let's hope they spend that £6 a week wisely that the government has given them for saving the Prime Minister's life. Finally, you're coming on to talk about this initiative for young people and for children, and you don't know how much it's costing, and I, as the journalist, do, and I do have the figure. Why are you so poorly briefed?
Sorry, what figure you took? £79 million?
Yes, that's exactly. Yes, this is. I did ask you how much it was going to cost, and exactly what will it provide for. This new initiative.
Sorry, I thought you were. Sorry, when you first started talking, I thought you were talking about how much the pay.
Because it's only fair. You've come on to talk about this initiative, the £79 million.
Oh yeah, thank you for asking about it. Thank you, Nick, because you're the first journalist to actually talk about mental health.
Well, honestly, Minister, if you listen back, I came in and that's what I asked. I did say, how much money is this initiative getting, and what will it provide for? So let's conclude. So that's honestly how I started. Let's conclude with that, because that's why you've come on, and it's only fair to allow you. It's £79 million, which you clearly knew. So let's set the record straight. You absolutely had the figures to hand. What will it provide for, and when will it start? Minister.
Okay, so we know that the past year, the pandemic has had an impact on people's well-being and on their mental health. But we know, because of the demands on services, exactly who has been impacted and who needs extra help moving forward to come out of the pandemic. We did provide, in addition to these 79 million, £8 million to schools to help children, the Wellbeing Return to School Fund, to help children when they return to school. But we know there are young people, particularly young women aged 15 upwards, actually, as far as 26, who've been particularly impacted by the pandemic, and those people with a pre-existing mental illness. But at the moment, we want to focus this money on children and young people. And one way we can get to young children and young people to help them the most is to get mental health support teams into schools. We started rolling that out with the long-term plan 3 years ago. And the NHS have actually done, in terms of mental health services, no mental health services is closed at all during the pandemic. We've got mental health teams working in schools. We want to rapidly increase that as fast as we can get people through postgraduate courses in universities and into schools. Because if you can pick up a well-being issue, an anxiety issue, a mental health issue such as eating disorders with children at an early age, you can make a huge difference. So this money is going about getting services in the front line, in front of children, extending CAMS, getting more children into CAMS, which is Children and Mental Health Services, and providing a 24-hour crisis helpline for children and young people with mental health problems. This is targeted at helping those children come out of the pandemic with as much help as possible in order to assist with their well-being and their mental health.
And I'm glad we got that out of the Minister. I must end there. Thank you. Conservative MP and Minister for State, Mental Health and Patient Safety and Suicide Prevention, Nadine Dorries. I think CAMS is actually Children and Adolescent Mental Health Services, but I'm not sure, but I think that's what probably she meant to say. 3 minutes after 8, news on LBC's next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, the Health Minister Nadine Dorries says the government cannot afford to give NHS staff in England a pay rise of more than 1%. Unions have described the proposed award as an insult to health workers following their efforts during the pandemic. Shadow Health Secretary Jonathan Ashworth says they deserve more.
Our NHS staff are fighting so hard to save people's lives. And the NHS staff who aren't on the wards in the hospitals are delivering the vaccinations which will get us out of this horrendous lockdown. I just find it unbelievable that they are not prepared to honour those NHS staff with a decent pay rise.
The government says ministers will carefully consider the recommendations of the pay review bodies when they report in late spring.